just to give you a refresher, before the midterm examination, we've been talking about the different infection control practices every time we prepare our instruments, or before, during, and after the termination of each of the dental procedures. So we have said, or you have learned that in order to simplify things, we must prepare our instruments in such a way that the possible transmission or contamination of the instrument must be avoided. Okay, so we have said that everything must be organized and everything must be set properly so that to avoid taking out instruments which are deemed to be sterile from our cabinets or from our drawers every time we need them for a particular procedure. So make it a habit, my dear students, that you have to prepare all the instruments that are needed for a particular procedure, for resto, for prosto, for surgery, for endo, okay, for perio, and so on and so forth. Okay, so you separate all of those instruments so that when you pick them up or bring them out from your cabinet or from your drawers, okay, they are supposed to be either individually packed, okay, or if not, collectively into one big pouch so that when you take them out, you take them out as a whole set of instruments rather than picking up one instrument, okay, at a time. So usually contamination happens if you start your dental procedures. Tapos, uy, may nakalimutan pala ako na, meron pa ako na-miss na isang instrument. So, you go back to your drawers, you go back to your cabinet. So, what happens? Okay? Anong mangyayari sa mga dandun na instruments? You have already touched some instruments there, you already opened them, they are considered as soil instruments already. So, most probably, you hold on the headlamp, handle of the headlamp, okay? You position the tray holder in your dental unit. So, meaning to say, you held almost every part of your dental unit. So, what the presumption there is that your gloves is already contaminated in one way or the other. Okay, so the number might not be that significant, but a microbe is a microbe. Okay, so meaning to say, contaminated na yung mga in-sterilize mo na mga instruments. Okay, so you have to prepare them and take them out as needed. Okay, so this afternoon, I would just like to emphasize. Okay, so this is actually the highlight of infection control course, okay, for this semester. So we are going to touch again on those guidelines regarding aseptic protocols. Okay, so vis-a-vis, we will be talking about personal protective equipments. Okay, so we are going to talk about the ideal mask, the different types of masks that may be worn inside the clinic, okay, surgical gowns, what are the different types of surgical gowns, uh, head caps, okay, face shields, and the last of which we're going to talk about proper waste disposals. So we're going to classify them whether or not they are household wastes, okay, medical wastes, industrial waste, and so on and so forth. So that you will be familiar, okay, and contribute to the realization of the goal and objective of the Department of Health, the Philippine Dental Association, okay, in association with the Department of Energy and Natural Resources, kasi yung environmental aspect, okay, and environmental factor or effect of the wastes coming from hospitals, clinics, and so on and so forth. So you're going to learn later on that you cannot mix up. You are not supposed to mix them in just one waste bin, okay, or trash bin. So hindi pwedeng paghalo-haloin mo. So, di ba, meron tayong practices in our barangays or in our respective houses that we're going to segregate, okay, biodegradable material from non-biodegradable wastes and so on and so forth. Ganun din po dito sa medical waste management. Okay, so again, my dear students, I would like to remind you of the importance of hand washing guidelines or yung hand washing protocols. I have already mentioned about this, and we have already more or less have already an idea on how to go about it. But since we haven't met for quite a long time, so 1 week, last week, okay, I might as well give you a refresher kung ano yung huling pinag-usapan natin about hand washing guidelines. Okay, so if you still remember, we have said that before we start with any intended dental procedure, be it simple or complex or complicated or major surgical procedures or major dental procedures, we have to make sure that before we hold anything inside our clinic, especially our sterile instruments and equipment, should always see to it that our hand is clean. Okay, and we have before we ever think of holding, ever think of holding any of the instruments, maybe out of curiosity, if you saw it for the first time, make sure that your hand is protected with a suitable equipment or suitable barrier in order not to contaminate the already sterile instrument. So we have to wash our hands before putting our gloves and immediately after removal of the gloves. Okay. So why is it that why is it necessary for us to wash our hands after taking off or removal of the gloves? The reason there is that there is no guarantee that the gloves, okay, not punctured, especially that you will be holding on something that is sharp. Like for instance, kahit na oral diagnosis pa ang gagawin mo, you will be holding on something that is sharp during your examination. Example would be the explorer. The explorer is a sharp instrument. It is a pointed instrument needed for oral examination, so to determine the presence of undercut, to determine the presence of caries, and so on and so forth. Okay, so you might not be aware that at some point during the routine checkup, okay, one of your gloves or one of the fingers, okay, or one of the gloves in your finger, one of the your gloves might be punctured with those sharp instruments, or if not, let's say for instance, you intend to do an incision on the mucosa of your patient, either in the maxilla or in the mandible. Okay, so you might not be aware that you already have created, okay, an opening in the gloves. So what I mean is that baka na-puncture yan or na-slice mo yan or nahiwa mo yung gloves. So meaning to say, you're already contaminating what is inside, which is your finger. Okay? So sabi nga natin, we have to protect ourselves at all times, especially when handling sharp instruments, because we cannot afford to contaminate or we cannot afford to injure ourselves, especially if those instruments already is in contact with the mucosa, saliva, with blood, and so on and so forth. So that is already considered as contaminated instrument. Okay, so wash your hands before and after the removal of gloves. Okay, then before we wear our gloves, make sure that we dry our hands. Okay, because you cannot insert. It is quite difficult to insert your hand inside the glove or in the gloves. Okay, if it is wet, so you have to dry it with hand towel or paper towel, as the case may be, for as long as make sure that the hand towel is more or less sterile. Okay, so before you don or you put your gloves. Then number three, okay, so washing is also required if inadvertently you touch contaminated objects or surfaces while bare-handed. So meaning to say, if you accidentally uh, touch a contaminated object or instrument, so let's say for example, nag-wash ka bago ka naglagay ng gloves, nag-wash ka after you remove your gloves, okay? Then let's say that you already put your instruments in a soiled basin or soiled tray, okay? But since you want to check whether or not the specimen or the extracted tooth is there, nakalimutan mo, hinawakan mo, natanggal mo ba, you're not aware that you already removed your gloves, yet you hold on something there on the soiled instruments, like for instance, cotton plier, okay, or college plier, okay, in your attempt to look for the specimen or look for the extracted tooth. So meaning to say, your finger is already contaminated kasi all of those instruments are already considered soil instruments or contaminated instruments. So, nag-gloves ka nga, naghugas ka ng kamay, but since you hold it with your bare hand, okay, that is already considered as your fingers as contaminated. So what are you going to do? You wash again your hands with a liquid soap. Okay, so just to ensure that nothing of the microbe, okay, is found on the surface of your fingertips or on your fingertips. However, okay, there is no assurance that there is a total absence of microbes at your fingertips. So that is quite impossible to prove. However, since microorganisms are not virulent if they are low in number or if the number is significantly low, but remember these microbes have the capacity or ability to multiply given the ideal condition. Okay, number four, you should always use liquid soap during hand washing. So that's the reason why they advocate the use of liquid soap compared to a bar soap because of the reason that I explained this to you before that some microorganisms could live on the surface of a soap, a bar soap. Okay, and one thing more is that since if you're going to put a bar soap, especially in the restroom or in any of the sink, so meaning to say there are a lot of people, a lot of contaminated hands that will be holding on that bar soap. So since microorganisms, some microorganisms are not destroyed and could live on the surfaces of this bar soap, okay, in order to prevent cross contamination, okay, among those who are going to use it later on, they advocate or they suggest that we should, in place of bar soap, we should use a liquid soap found in dispensers. So these dispensers are either electronically or mechanically driven. Okay, so same is true with the faucets that we're going to use. So there are some high-end hotels, high-end clinics, high-end hospitals, or let's say uh, call it class A hospitals. Okay, they already get rid of the knob that are found on the faucet. They are usually either uh, they call this contain foot pedal at the bottom of the sink, or if not, yung tinatawag natin na sensors, which are electrically or electronically driven. So I don't know if you have a chance to visit the dental infirmary. During our time, we've been talking about infection control, pero because of, what do you call this, uh, hindi pa sila ganun ka-stricto sa Department of Health and everything. So during the time na na-accredit ng University of Baguio, so they become stricter in as far as uh, protocol is concerned. So if you have a chance to visit the dental infirmary, they think there when you go to prosto, resto, or surgery department, okay, may mga foot pedals na ang mga yan. Hindi na yung mga faucet na iniikot natin. Okay, so that is to discourage clinicians to hold the knob. So foot control na lang. So hands free, kumbaga. Okay, so yung mga faucets natin dyan, maganda. It's very, very, very ideal. Okay, and very safe, if I may say, for possible cross-contamination. So since we are dealing with patients, a lot of patients in any department, every department, kasi pwede ka namang pumunta sa prosto, kahit nasa resto ka, maghugas ka sa prosto, with your hands only, but not with your equipment. So pwede. But if it is not provided with food control, so I cannot just imagine how many microbes will be present in one faucet knob. Marami. So, cross-contamination ang mangyayari. Okay, so these based on the study, these are the surfaces of our hands that are frequently, or most frequently, or less frequently missed during hand washing. Okay, so yung mga nasa violet, blue-violet color, so these are the most frequently missed part of our hands during hand washing. So ito yung titignan natin lagi. That's the reason why they encourage us to clean our hands, especially in our case, being in the medical profession, that we have to clean our or wash our hands using the scrub technique. Okay, so we have to practice that every now and then. Okay, and be very observant and very particular in our way of washing our hands. So yung mga yan, yung mga webs natin dito sa pagitan ng mga daliri natin, so those are the frequently missed areas. So yung mga fingernails natin, yan mga yan. So okay, yun yung mga binabrush natin ng mga parts. Okay? So sa anterior or ventral portion of our hand, sa palm of our hand, so ito naman yung mga most frequently missed portion. Okay? So, not missed itong part na to kasi madali lang eh. Ganyan makikita mo. Pero dito, pag ganun mo kasi hindi magpapas dito, so kailangan mo iganyan. Okay? So, if you're going to just wash your hands like this, so that will be incomplete. So, meaning, so nakaganito na, so ano mangyayari dito in between yung fingers? So, dun, baka nandun yung bacteria. So, ang ginagawa natin, ikot natin, ganyan, then we do like this. Diba? Yan. So, dito naman, yan. Yan. Diba? Ginaganon natin. So, ganun yung mga pagka-hand wash natin. So, you can actually do that at home. You can practice it at home, the proper hand washing. because they are going to observe you, my dear students, during the time that you will become a clinician. So once you become a clinician, the responsibility is greater. So because you will be dealing with actual patients. Although in CD, mag-actual patient kayo in the fabrication of denture for clinical as a clinical preclinical requirement, you will be handling patients there. However, if you are in the infirmary already, you will be dealing with a lot of patients, and there are a lot of and there are many requirements that you're going to finish in order to hone your skills and develop your skills, okay, and gain more confidence and knowledge as you go along and finish all of your clean requirements before you will be declared graduate of dental program or dentistry program. Okay, so it's always good. It's always nice to uh, protect ourselves and follow the protocols. So if we really care for ourselves, we must also care for other people. Okay, so sabi nga nila, no man is an island. So if you care for yourself, you might as well care for other people because if other peoples are contaminated, there will come a time that you yourself will be contaminated or harbor those bacteria or microbes. Okay, so this is an example of a hands-free uh, sink provided with a sensor. So this is quite an old illustration of a sink with sensor. Usually, yung mga sensors natin, they are usually embedded already here, somewhere here. Pero ito, parang yung sensor niya nasa taas. Or I don't know, this is the faucet and that is the sensor. So this is where the uh, the water will come out once you position yourself or your hand to, near these two sensors here. The only problem here, my dear student, is in the absence of electric current. Kung brown out siya, so ibig sabihin, this won't work. So what is the lesson here? That it should be a combination of a foot pedal and a sensor as well. So in the absence of sensor, pwede mo pa rin magamit because of the presence of the foot pedal. Okay, in order to release the pressure coming out from this opening or from this faucet here. Because if it is solely electronic driven or electronically driven, so pag walang kuryente, hindi mo magagamit itong sink na to. Okay? Chances are, tabo-tabo system ang gagamitin natin. So, wherein it is not favorable in our part, it is not recommended on our part because uh, of possible contamination. Okay, so what are the different procedural guidelines or steps that we have to follow before we are going to wash our hands? So, this is the recommendation of the people who are in charge in infection control practices. So they recommend that before we wash our hands, we have to remove all possible jewelry, rings, okay, watch from our hands. So I think this was already mentioned to you several times in other disciplines or in other subjects. Okay, and I would like at this point I would like also to remind you that you have to make this as a habit so that your attention will not be called in once you enter the clinic. Kasi nung panahon namin, so our instructors, almost all of them, always remind us of this protocol. Okay, so sabi nila sa amin, so uh, in order for us to prevent miscommunication or misunderstanding, okay, inside the clinics, okay, we have to observe proper aseptic protocol. And this is one of the protocol or guidelines or procedure that you have to put in mind. Okay, so you should not wear anything in your fingers or in your hands. No watches, no rings, okay, no bracelet, no jewelries, that is to say, inside the dental infirmary. Okay? So, the reason being, yung mga sulok-sulok na mga jewelries natin, there are microbes there. So, that is the point. Hindi yung dahil wala silang ganun, ayun lang ipasod sa inyo. No, that is not the point. The point there is that there could be contaminants present in your jewelries or in your rings, especially when you wear the ring for quite a long period of time because you cannot remove it anymore from your ring finger if you are married or otherwise. Niregalo ng boyfriend mo, niregalo ng tatay or nanay mo, hindi mo na natanggal kasi nung inirigay mo, payat ka pa. Okay? Ngayon, okay, medyo sabi ka na or malaki na yung katawan mo. So what happens? Lumaki na rin yung joints or kung ikaw pa yung laging crack or kukuan ng mga fingers mo, talaga malaki. So hindi mo na matanggal. Sasabihin, are you going to tell your clinical supervisor, sir, ma'am, paano po yan? Hindi ko po matanggal yung ring ko. So there's no excuse. There's no exemption to the rule. So if they say that you have to remove everything, you have to remove everything. Okay, so what would be the remedy? You remove the ring finger? No. You go to the shop or to the jewelry shop and have them remove your ring. Okay, so hihiwalay lang naman nila. They are going to separate it and remove it. Okay, so as to how, okay, they know better than I do. So alam nila kung paano tanggalin yan. So for as long as you have to follow protocol. So kasi it's very difficult to clean the jewelry. Okay, or to clean clean the jewelry because of the joints or the connections. Mahirap linisin yung part na yun. So pwedeng nandun yung microorganism. Remember, microbes are microscopic. Okay, so this can also harbor microbes, especially pag napawisan na. Okay, so there could be dirt or impurities that are found in between, okay, the joints of your jewelry or watch or ring. Then sometimes if your ring contains a gem or a precious stone, they usually meron yan kinakapitan, which is somewhat sharp. So when you don or when you put on your gloves or when you remove your gloves, pwedeng sumabit yan, pwedeng mapunit yan, and there could be a possibility of puncture also of the gloves, okay, so which could result into contamination of your hands. So it defeats the purpose. So in the absence of electronically driven or in the absence of foot pedal and or if not, if your sink is not equipped with those things, okay, so ang meron ka lang is a lever like this, or a knob, or yeah, a knob. So in the absence of those uh, system, electronically driven or foot pedal, so you can actually get uh, what do you call that? Paper towel, or yung anong tawag natin dun sa tissue na may alcohol? Wipes? Wipes ba yan? Hello? Can you still hear me?
Sir,
Tama ba? Anong tawag natin doon?
wipes po.
Wipes. Not wives, Wipes. So, pwede natin gamitin yon because it contains, I'm not quite sure, pero what I know of is that meron siyang alcohol, kaya wet siya, kaya tinawag na wet wipes. Hindi naman tubig yung kung hindi alcohol. So, you can use that also to hold the lever of your uh, water system or yung faucet natin. So, pwedeng gamitin yun in the absence of electronic control or foot control na lever in our water to regulate the water flow. Okay, so pwede nating gamitin ito. So because not all clinics are equipped with a sophisticated gadgets or sophisticated devices, mahirap lang tayo, pwede ito. Pwede ganyan, gumamit ka lang ng wipes. Okay? So, of course, after you wash your hands with running water, wet your hands with running water, then itong part na to, kung nakikita nyo, if you see this in your monitor or in your monitor. So this is a dispenser for liquid soap. Okay? Pwede ito. Okay? But my only comment here is that since ipupush mo ito para ma-dispense yung liquid soap, medyo mako-contaminate yung part na to. So, I rather advise you to have a electronically driven or operated liquid soap dispenser. Okay? May mga sensors din kasi, pwede yan. Okay? Or if not, pwedeng foot pedal. Basta huwag mong hahawakan, supposedly, ideally, any of this para hindi makontaminate yung kamay mo at hindi mo rin makontaminate yung faucet. Okay? So, make sure that you wash your hand in a running water, hindi yung maglalagay ka ng soap, papatayin mo because you are conserving water. Okay? Tapos, i-open mo ulit. Okay? Then, i-close mo ulit. Open, close, open, close. So, meaning to say, there are several chances for you to contaminate those levers or the faucet. Okay, so make sure that when you apply the soap, you have to do the scrub technique. Okay, so circular motion with friction while holding your fingertips downwards. Then rub well between your fingers, parang ganito. Yan, no? So, tatapos ka sa left, tapos sa right. Pagkatapos yan, dito ka sa palm of your hand. Pag ganun pa rin, okay, ganyan, ganyan. Okay, pagpunta rito, ganyan. Okay, so ganyan. So, dito man sa kabila, ganun din. Okay, yan. Okay, so lahat, pwedeng ganyan. Walang problema dyan. Okay? Oh. So, for as long as you cover everything, then dito, kung wala kang brush, talagang pagtsatsagaan mo. Okay? So, ganyan mo dito rin, ganun. Okay, dito, ganyan. Lahat. So, it takes time before you finish washing your hands. So, hindi yung parang dati, ganun lang, oh. Basta lang bumula, oh, ganyan na. So, kumusta naman yun nandito sa pagitan ng mga fingers mo? So, yun ang frequently missed areas. Okay, because you are in a rush, yan, oh, papasok na ako. Nag-check na si Sir ng attendance dun sa subject ko sa infection control. Okay? Usually, gano'n ang nangyayari sa clinic, di ba? Tapos titignan ka ng ibang clinicians, oops, kumusta naman kami na nawisikan mo, parang something like that, no? So, pati kami damay. So, make sure that you spend time doing this procedure. So, yan. Bagal yung internet, ah. Okay, so make sure that your choice of the liquid soap, yung tinatawag natin na medical grade na liquid soap, okay, na meron, di ba yung mga liquid soap natin yan, may mga nakalagay pa na antibacterial, mga ganyan. Although, it is more expensive compared to the local or the commercially prepared liquid soaps. Okay, so make sure that in the selection of the material that you will be using or you will be utilizing in your practice, make sure that they are considered as medically grade, okay? Medically grade liquid soap. No, what happened? Bakit nawala na? Can you still hear me? Naririnig niyo pa ba ako? Can you still hear me, my dear students?
Yeah.
Okay, so natin, i-icon na lang natin itong iba. So I'm just going to show you how it is done. So ito, yeah, make sure that when you wash your hands, it should be under a running water or stream of running water. Okay, hindi yung open mo then close mo. So it should be running water for at least 10 seconds. Okay. Then use a paper towel to dry the hands thoroughly. Okay. You also have to dry the forehands or forearms rather. So make sure that you're going to dispose the contaminated hand towel in the the bin before you're going to don or before you are going to put on your gloves. Okay, so at the onset or the start of the lecture, I mentioned to you that after you wash your hand before and after, okay, you make sure that you have to dry your hands before you put on your sterile gloves. So yung gloves natin kasi there are different types which I'm going to present to you next meeting. Kung ano yung mga different types of gloves, different types of mask, o yung tinatawag natin ng mga medically grade na mga mask. So kaya meron tayong mga tinatawag na N95, N92, N90. Ano ba ang ibig sabihin ng mga yan? Okay? So it has to do something with their ability to prevent, okay, minute particles, okay, or their ability to prevent possible contamination during inhalation or exhalation. So what is the proper way to or the proper way to put on your surgical mask and everything that we are going to discuss next meeting. Okay? So do you have any question at this point? So next meeting we're going to talk about the mask. Okay? The mask, the head cap, the the gowns or surgical gowns, and lastly, waste management. Yun na yung huling pag-uusapan natin next meeting. Okay? So any question at this point? So by the way, the highest in your exam is 48. Sino ba yung 48 dito? 48. Yung mga iba, forgotten. I'm sorry. Mas mababa yung mga nakuha ng mga iba. Sino ba yung 48 dito? Ayun ako nakitang 48 eh. Sino ba sa tingin nyo ang naka 48 dito? So, ito yung highest sa dalawang sections na hawak ko. Sa kabila kasi dalawa nakakuha 47 dito. Isang 48 then isang 46. Just forgot the name of the babae yata ito eh. Ito. Yeah. Lalaine Antonio. Siya yung highest sa exam ninyo, 48 out of 60. So, 12 mistakes lang. Medyo batas ng konti. Okay, so the rest, makikita nyo na lang. I'm going to return your corrected test paper. Pagpalik ko dyan sa Baguio. Sasabihin ko kung kailan yung ating face-to-face before the final examination. I need to see you before the final examination. So, to remind you of the things that are expected of you before the end of the semester. So, at this point, my dear students, I would like to remind everybody that there will be no re-exam. Wala pong project, walang extra work and everything. So I'm just going to compute your class standing based on your quizzes, and maybe some assignments will be given to you before the final examinations para makadagdag ng konti for your exam. The uploading of your grades will be done maybe next week because I can't upload your grade as yet dito sa amin kasi makita nyo man mabagal yung internet dito. So, nahirapan akong i-upload yung grade ninyo. Kung gusto niyo malaman yung grade nyo, I can give it to you on Thursday. But make sure, ito, if you are just, I'm not going to announce it. Okay, so just send me a personal message, then I can send you your own grade on Thursday. Okay? So Thursday ng hapon siguro after kasi magpi-clinic pa ako sa umaga. So that is a tentative, that is unofficial grade because the official grade is supposed to be coming out from the portal. Okay? So more or less, yun din yung grade ninyo sa lalabas sa portal. However, it is unofficial since manggagaling lang sa akin. So, to make it official, dapat na-upload yan sa portal. Okay, Miss Lopez? Did I answer your question or query?
Yes, sir. Thank you po, sir.
Yes, don't worry. You will definitely see your grade before the finals. Para alam nyo naman yung standing ninyo kung pasado or kailangan pang magsunog ng kilay bago ang final examination. For those who did not make it after you receive your grade, it is not the end of everything, no? So you still have a lot of time to catch up. However, you need to really give your best shot. Okay? Kasi survival of the fittest ang mangyayari dito sa subject natin. Kung sino lang ang papasa, sila lang talaga ang papasa. Kung sino ang maiiwan, okay, since bata pa naman kayo, you have all the time, okay, to catch up. Magkikita-kita rin kayo sa clinic. That's for sure. Okay, so any more query or questions? So that is with regards to the grade. Ano pa, may iba pa kayong questions how about with regards to our discussion this afternoon or this evening? Do you have any questions or clarifications to make? Meron pa ba or wala na? So, none for Sophia. How about the rest? Wala nang query? Okay, so wala na rin kay Devero. So, I hope kung meron kayong mga queries later on, pwede naman kayong mag-send sa ating GC or if not, you can send it through a personal message kung meron kayong gustong tanungin at nahiya kayong tanungin dito, you just send a message and I'm going to reply, okay, favorably to your query. So since there are no more queries or there are no more questions, then we will call it a night. Thank you very much for your time and have a good night. See you on Thursday.